as Peter indicated, I'm a toxicologist, so please don't everybody run for the doors and leave the meeting. So I know that I'm surrounded by nutritionists of a very high level. So with that, Peter also mentioned I'd like to thank ILSI for providing me with the opportunity of presenting my research today, but I'm also head of a food and nutrition group at Intertek, which provides consultancy services to the food and food ingredient industry. So my conflict of interest disclosure would run to several pages if I was to include every single food company that we work for. So global safety and regulatory processes for the evaluation of low-calorie sweeteners. So in my talk today, I would like to split this up into firstly the safety evaluation, looking at what the regulatory requirements are to get a high-intensity sweetener approved and on the market, looking specifically at the types of safety testing that we have to do, the toxicology studies, and then spend a little time as to how we derive the acceptable daily intake, or ADI, which is associated with all of the high-intensity sweeteners that are currently on the market and consumed. And then briefly just look at the regulatory outcomes that I believe has already been touched on by two of the speakers. And then I'm going to spend a little bit of time covering some typical questions that I get when I give this type of lecture. I was in China recently and also India, supporting the safety of high-intensity sweeteners. And I get similar questions all the time, so I should just be looking at a couple of those. And then a couple of the recent controversies that have been out there regarding low-calorie sweeteners, which has already been touched on a little bit by the previous two speakers. So all high-intensity sweeteners, low-calorie sweeteners, have to undergo pre-market authorization evaluation, which is a very strict, thorough process. And I've just listed here some of the regulatory authorities that undertake these evaluations. Whoops. And these include the European Food Safety Authority, the FDA, Health Canada, EFSANS. And it's also important here that the Joint Expert Committee on Food Additives is probably the organisation which supports the global community for those countries that do not have their own in-house expertise or safety evaluation folks. So JECFA is a key organisation, but they do not approve sweeteners, they just provide safety opinions. And at the end of the day, all of these regulatory authorities and JECFA assign an ADI to a specific sweetener. So what is an ADI? Well, I've put up here the definition of JECFA. It is an estimate of the amount of a food additive expressed on a body weight basis that can be ingested over a lifetime without appreciable risk. And I want to focus on lifetime. This is not a day, this is not a week, it's not even a year. It's over a lifetime of consumption. So that hopefully puts it into perspective how safe these materials are. The ADI is expressed on a milligram per kilogram body weight basis. And I just wanted to point out that this ADI safety assessment paradigm has now been in operation for over 50 years. So nobody has really ever challenged the concept of a safety evaluation based on ADI. And so all of these authorities that I've just mentioned, including JECFA, assign an ADI based upon the safety database, which I have to admit, in 9 cases out of 10, is put together by the company developing the actual sweetener. And once those sweeteners are approved, then they're added to a positive list of ingredients. So if you go to the European Commission and search on sweeteners, you'll find a positive list of those that you can use within foods throughout Europe. So what constitutes a safety database? What needs to go into a safety database? Well, we need to incorporate both technical information, which includes manufacturing specifications and technological function. In the case of a sweetener, that's its sensory characteristics. We also have to include safety studies, the toxicology studies, as well as an exposure analysis. And all of that combined equates to a risk analysis. I also want to point out that it's not, you have to do these studies to specific guidelines, and there are guidelines out there laid down by the FDA, OECD, and EFSA. And you have to perform these studies to very high standards, which are laid down by GLP conditions. So, yes, you cannot do such a study in the back of your laboratory or set up a study in your garage at home to do such research. No, these are very, very specific studies that have to be done to very high standards. And once we've conducted or prepared this dossier, then it's submitted to the various regulatory authorities. So what types of toxicology tests go into this safety database? Well, I've just listed some of them here. Some of the more important ones, of course, and it really is a comprehensive battery of types of studies that you need to do in multiple animal species. One of my key areas of expertise is pharmacokinetics, and we talk about this in terms of absorption, distribution, metabolism, and excretion. And this is key because what we're trying to do is look at whether the animal models that we do our toxicology studies in are appropriate for the safety assessment in human beings. So that's very key. We also look specifically at carcinogenicity studies, reproductive studies, also looking at potential birth defects. And in the case of high-intensity sweeteners, while it's not a requirement as laid down within regulations, it's key that we do studies in diabetic subjects because this population are usually high consumers of high-intensity or low-calorie sweeteners because they want to reduce their sugar levels. So all of these studies go into the dossier, which must be filed with the authorities. And I just pointed out here, it's not acceptable to ignore any of those studies that you don't like. I go to the FDA on a regular basis, and one of the things that they always say to me is, you have to send to us the good, the bad, and the ugly. You can't just send them the good results without sending them some of those data that doesn't quite fit with your safety paradigm. Everything has to be submitted to the authorities. And if you don't, you could end up in big trouble. So, why do we do these toxicology tests? Well, it's obviously to provide safety assurance. So how do we do this? Well, we provide animals with very high dosages, and that is, we give them high dosages. It's obvious to try and see if there's any adverse effects at such multiple doses. But we also like to give high dosages to define what we call a no observed adverse effect level, and I shall come to that in a little more detail later. So the no effect level is usually derived, especially for a high intensity sweetener, from long-term studies, and in this case there'll be chronic toxicity, carcinogenicity studies. But I also want to point out here, I've been doing research on high intensity sweeteners now for nearly 40 years, so slightly giving away my age somewhat, and started off in the laboratory of Professor Andy Rennick, who was one of the gurus of high intensity sweeteners. So I've been doing a lot of research in this area for many years, and I can tell you that low-calorie sweeteners are some of the most least toxic materials that I've ever had to deal with, and this allows you to dose 10-20% of the diet to animals without showing really any significant toxicological effects. I'm not going to say without any effect, because when you start giving such high dosages, you run into physiological effects, of course. So, how do regulatory authorities derive an ADI? Well, I'm sure a lot of you know, and as I just said, you take the no observed adverse effect level, and then you apply a safety factor. And this no observed adverse effect level, as I've previously mentioned, comes from long-term studies, but it has to come from the most sensitive endpoint in the most sensitive species. So if you've done a study in a rat that's totally clean, but also done a study in a mouse, which shows no effect in males, but there is some effect in females in terms of increased liver enzymes, then unfortunately you have to use that level where you see increased liver enzymes. So that gives you your no observed adverse effect level. And to this you apply a default safety factor which accounts for differences in inter-subject variability, and also the differences between humans and animals. And if you look at this pictorial diagram here, we have a rat, and the no observed adverse effect level in that study was 100 milligrams per kilogram per day. So taking into account interspecies variation, we're down at the 10 milligrams per kilogram level, and then the inter-subject variation. So applying that 100-fold default factor, we end up with an ADI of 1 milligram per kilogram body weight per day. To do a risk analysis, we also need to understand what the daily exposure is. And if it's a new additive, we obviously don't know that from a standard perspective. So we have to do what we call an estimated evaluation using food survey databases. And in the US and in Europe, we have some really good food survey databases. NHANES, and in Europe we have the comprehensive database. And in the UK we also have a really good NDNS database. So what do? We then determine what food categories you want to add your sweetener to and what level. And then we plug this into the food survey database and use some computer models. And what it does is it calculates what the exposures are. You get a mean exposure, and then you also get high consumer exposures at the 90 or 95th percentile. And we can look at this for different age groups and for males and females. And as I said, this calculation assumes that this food additive is in all food categories at the maximum exposure levels, which isn't reality. But what that does is it provides an overall conservative estimate of intake over a much longer period of time. So it provides, again, some increased level of reassurance that we're never ever going to approach that ADI. So just looking at some of the international regulatory outcomes, which goes back to all of those regulatory authorities I outlined in one of my original slides, the approvals permit use categories and levels, and these are termed conditions of use. And as I mentioned before, you can go into the Sweeteners Directive in the EU or Health Canada and pull out what food categories you can add your sweetener to, or what additive, and at what levels you can add this to. Slightly different in the United States at this moment in time, because a lot of the high-intensity sweeteners are considered general-purpose sweeteners. So there's no limitation on what levels they can use in various food categories. And this is primarily based on the fact that FDA does not consider these materials to have any real safety implications. Once you've filed your application and there's approval, this leads to a change in legislation, and in the United States it leads to a change in regulations within the CFR, and in Europe the Sweeteners Directive. But in the US we also have a unique process called the generally recognized as safe process, and there have been numerous food additives that have gone through this process, and recently stereoglycosides and low-hand-row have been approved through the GRAS process as opposed to the food additive partition process. And so stevia glucosides in low-hanging growth have not been laid down within the Code of Federal Regulations. However, you can go on the FDA website and look up the GRAS notices to see the approval status there. So this is a table of all the currently accepted sweeteners that have been evaluated by the JETFA. And I'd just like to point out, as Dr. Pisanius said, all of these materials are very different from a structural perspective, and also from a sweetness perspective. And so this leads to differences in terms of the calculation of the acceptable daily intake. And you can see here we have aspartame at 0 to 40 milligrams per kilogram, whereas neotame is down here at 0 to 2 milligrams per kilogram body weight per day. Importantly, you can go to these nice yellow JETFA booklets called the JETFA monographs, and within these monographs it gives you a complete overview of the safety analysis for each of those sweeteners and every other food additive out there, by the way. And it shows you quite clearly how they came to the conclusion on the safety and the derivation of the ADI. Typical questions that I get on doing these types of talks. Are sweeteners safe for children? Are they safe for pregnant and lactating mothers? And what happens if I exceed the ADI? So just to look at this very quickly. So when we're doing our safety analysis of sweeteners and food additives, these toxicological protocols are prepared to cover all periods of human exposure, including rapid growth and development, maturation, and aging. And we look at this through studies, reproductive studies, where we conduct 2 generation studies, so over two life cycles. And we also look at birth defects. And so exposure is during reproduction, as well as the juvenile period, is taken into account. And so the ADI does apply to children and pregnant and lactating mothers. The only instance where this doesn't take account is for infants and babies less than 3 years of age who are receiving infant formula in unitary diet, but I don't really have enough time to cover that off today. So also, what happens if we go above the ADI? Well, I'd just like to say that the ADI is not a toxic threshold. It isn't a lower bound of toxicity either. So just to put this into perspective, the JETFA indicated, and I just want to read this out for those who cannot read it at the back, because data are extrapolated from lifetime animal studies, the ADI relates to lifetime use and provides a margin of safety large enough for toxicologists not to be concerned about short-term exposure levels exceeding the ADI. And so any small day-to-day variations that we see that exceed the ADI really have no impact on the safety of the overall lifetime exposure to that sweetener. And as I mentioned earlier, high-intensity sweeteners, low-calorie sweeteners are some of the most least toxic substances. So you're not going to ever see any acute toxicity from going above the daily intake. Some recent controversies, 2 that I've just highlighted here. Does sweeteners cause cancer? And something that Dr. Pisanius just picked up upon. Do they impact the microbiome? Well, there's been 4 studies conducted by the Ranazzini Institute, which is an institute that is based in Italy. They did 3 lifetime experiments with aspartame and 1 with sucralose. These are non-standard protocols. They don't meet the Red Book, OECD, or EFSA guidelines. These are lifetime experiments. So these are the only studies to date that have shown any effects of high-intensity sweeteners in producing cancer. And in contrast, none of the carcinogenicity studies that have been conducted to these guidelines, FDA guidelines, have ever shown any carcinogenicity. These studies, when they were published, starting in 2005, obviously caused a great deal of consternation to everybody. The public, the press pulled it up, and so the authorities had no recourse but to go back and evaluate those thoroughly. And so you see here, EFSA evaluated it, the French authorities, the US, NTP, FDA, Health Canada. And so all of these folks specifically reviewed the aspartame data, and all of these groups have come to the same conclusion, that there is no credible evidence that aspartame is carcinogenic. And in addition, the EFSA has recently, as you will see here, 2017, just recently reviewed this study that the Ramazzini Institute, which was published by Sofridi on sucralose, and EFSA concluded that the data did not support the conclusions of Sofridi. And here's just a couple of slides showing the opinions from EFSA. EFSA completes a full risk assessment on aspartame and concludes it's safe at a current level of exposure. Likewise, the opinion from EFSA on their review of the sucralose studies, and they concluded that the available data did not support the conclusions of the authors that sucralose induced hemopoietic neoplasms in male Swiss mice. So I don't want to spend too much time on this microbiome issue. Dr. Pissonnier specifically went through some of the data, but I did want to highlight specifically what he began to address, in that there were some significant limitations in this publication, which called into question the outcomes of this study. And these, for me, included a lack of isocaloric control groups in the animal or human studies. So I think more so you in the audience are aware, if you're looking at impacts on the microbiome, you have to be sure that the caloric content of the diet and what they're receiving is similar. Because if these groups are receiving different diets, then you don't know whether it's the sweetener causing the effect, the food additive causing the effect, or just a change in the diet itself. And also, I wanted to point out that these studies also dosed, in the animal studies, really high levels of the high-intensity sweeteners, significantly greater than what we would be exposed to on a day-to-day basis, and much higher than the ADI levels. And just to put that into perspective, these two graphs were published in this Suez paper, and you can see here, this blue line is the saccharin intake, liquid intake, while this is the water intake. So significant difference in fluid intake in these animals, and a significant difference in chow intake. So you can see clearly that there's big differences in the day-to-day consumption of the diet and liquid beverage, which is going to impact the microbiome. And also, calculating what the intakes are from these graphs here, we ended up with dosages over 1,000 milligrams per kilogram body weight per day. And you can see how that relates to the ADI, significantly greater. So what is that? What relevance is that to the human situation? So from my perspective, very little. So in conclusion to that study, and also, pulling into the equation what other studies are out there, there's really no scientific literature in the public domain which indicates that low-calorie sweeteners have any impact on the microbiome, which then leads to secondary effects, as outlined by Dr. Pissonnier. So there's no adverse health effects mediated by the gut microflora, which can be assumed based on the current available data that's out there. So my final slide, and in conclusion, a large body of evidence has to be generated to support the safety of all currently permitted low-calorie sweeteners. And companies spend many years and many millions of dollars in developing high-intensity sweeteners. The safety of these have been critically reviewed by numerous regulatory authorities, and pretty much they all come to the same decision. So these are independent evaluations, and they all come pretty much to the same conclusions. And even though there's been a number of controversies regarding low-calorie sweeteners and the safety, all of these regulatory authorities around the world and JECFA continue to support the safety of these ingredients for use in our diet today. And with that, I'd like to thank you for your attention.